Hi guys!
So this week's video is about ADHD. ADHD, also known as Adult Attention Deficit Hyperactivity Disorder, is a mental health condition that encompasses persistent issues. These problems can include attention issues, hyperactivity, and behavior that seems impulsive. It can cause a multitude of difficulties in daily life, but it can be treated. Even if this condition is referred to as adult ADHD, it usually starts during childhood and can continue into adulthood.
There aren't any exact causes for ADHD, but there may be some factors that may lead to the development of this condition. First, genetics plays a major role as it may run in your family. Next, certain environmental factors may also put someone at a higher risk of getting this condition. Lastly, issues when developing or aging may also cause the condition, as sometimes problems may occur in the central nervous system of the body. These are the main causes of ADHD.
As people with ADHD get older, the amount of symptoms they have and the severity of them decreases. Although some adults can still have huge signs and symptoms that affects their daily activities and more. Lots of adults with ADHD don't usually know that they have this condition. And the main issues that they usually struggle with are paying attention and prioritizing, restlessness, and impulsiveness. Some of the common symptoms of ADHD in adults are being disorganized, having issues with prioritizing, impulsiveness, bad time management, difficulties focusing, hard time multitasking, restlessness, and bad planning skills. More signs and symptoms are being easily frustrated even by small things, persistent mood swings, issues in finishing tasks, anger issues, and a hard time dealing with stress. There are some disorders and substances that can lead to signs and symptoms that are similar to the ones that are caused by ADHD. These can include mental health conditions such as depression, anxiety, language deficits, learning deficits, disorders that affect conduct, and other psychiatric conditions. Medical issues concerning thinking and behavior such as thyroid problems, sleep issues, and hypoglycemia can also be mistaken for ADHD. Certain substances such as specific drugs and alcohol can also be mistaken for ADHD.
Some disorders may occur alongside ADHD, and they can make treatment very challenging. Disorders that occur with ADHD are mood disorders, anxiety disorders, psychiatric disorders, and learning disabilities. Mood disorders include depression, bipolar disorder, and others. These may occur due to repeated failures, frustrations, and other worsening conditions. Anxiety disorders may also occur, and they may cause worry, nervousness, anxiousness, and other symptoms. Psychiatric disorders such as personality disorders, intermittent explosive disorder, and substance use disorder may also occur. Lastly, learning disabilities may also show up, and lower output on academic testing. These are some conditions that may occur with ADHD. Treatment involves medication, education, skills training, and psychological therapy. These treatment options may help manage the symptoms, but they don't cure ADHD. Stimulants are some medications that include methylphenidate or amphetamine. They are prescribed as they can boost and balance neurotransmitters. Other medications can include atomoxetine and antidepressants such as bupropion. These work slower, but they're also very good options. Please refer to your doctor for the right prescription and the right dosage. Psychological counseling is also very effective as it can educate someone about the condition. Psychotherapy may help you improve your skills, reduce impulsive behavior, develop problem-solving skills, cope with failures, raise self-esteem, and help create relationships. Common types of psychotherapy are cognitive behavior therapy and family therapy. Cognitive behavioral therapy teaches specific skills to manage behavior and change negative thinking. It can also help deal with challenges. Family therapy is also very helpful as it can help one cope with family issues. This way they get along better and they can understand each other. Other remedies such as making a to-do list, using sticky notes for reminders, making a big tasks, creating a book, or using online sources that tracks appointments, having a note card next to you, carving out time to get everything organized, creating a routine, and asking help from others may also be very effective to deal with symptoms of ADHD.
Since ADHD can greatly affect many areas of a person's life, it can cause complications such as poor performance in school or work, financial struggles, being unemployed, issues with the law, substance abuse, persistent accidents such as car crashes, problems in relationships with loved ones, low self-esteem or bad self-image, and attempts at suicide.
The chances of a person having ADHD may become higher if you have blood relatives who have this condition or other mental health conditions. If you have a mom who smoked or drank during pregnancy, then your risk is significantly higher. Then, if you were exposed to environmental toxins such as lead in pipes or other chemicals, then you also may have a higher risk. Lastly, if you were born prematurely, then you also have a high risk. These are the main risk factors of ADHD. ADHD is a prominent disease that affects many lives, so it is important that you are educated about it.
Thank you for watching today's video. We hope you enjoyed it and learned a lot out of it.
Yep. Like this video, subscribe, and comment down below what you want us to do next. And don't forget to share this video if you liked it or found it informational.
Also, the citations are also in the link down below in the description.
And our Instagram for Health Kiosk.
Bye!